Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
The fact that the HPV has been started at an early age, probably at 9 or younger, and has it been expanded to the age of 45 because it is preventive of cervical cancer. It's the prevention of cervical cancer. And the source of the virus is, of course, generally the man. And so it's important that the men and the women take the virus, so the men don't give the women the virus that causes cervical cancer. And they talk about that because many people don't realize that that is probably one of the commonest viruses. It is the most common sexually transmitted virus, and it is the cause of cervical cancer, and many women die every year of cervical cancer. And so this is a treatment for cervical cancer. It also is a cause of oral cancers in men, and so that the vaccine is something that should be given to students. As a teacher, I'm sure you know about that, and you also know the resistance to taking it. Of course, if you don't take the HPV, then pap smear is something that you need to have done every year or annually after the age of 40, or every other year after the age of 40. If you take HPV, then the need for it diminishes or goes away. And as you go past the 20s and you go into the 30s, then the importance of the family history for women becomes important, because whether or not you have a family history of cancer of any type. Also, some people, it's thought that between 20 and 80% of women develop fibroids between 20s and the 50s. And fibroids can often cause a number of problems, difficulty having sex, having another cause of frequent urination in women. And although it's benign, it still can cause pain and require the need for hysterectomy in certain circumstances. And then, of course, the mammogram, which is thought to be required after the age of 40, but we're finding in African Americans, we have a cancer of the breast earlier than 40. But having that on a yearly basis becomes important. And then, of course, the colon cancer screenings starting at 45 becomes important, as well as the importance of physical exercise. And of course, it's important for men and women, but they are principally talking about the impact on women and the loss of muscle mass. And so one of the most important things to do as you age is to increase your physical activity and weight bearing and exercising. And then as you approach the 50s, lung cancer screenings with x-rays becomes important, as well as a recognition of the menopause and the fact that you don't have to bear the agonies of menopause, and that there's treatment for many of the causes, many of the phenomena that go along with the cessation of the period, and that it can be treated. And so going to the doctor and requesting treatment for the signs and symptoms of the menopause becomes important. And then, of course, as you go into the 60s, the bone density scans become important because of the osteoporosis that is not infrequent among the women above 60. And then the importance of the hearing exam and the vision exam on an annual basis becomes imperative after the age of 60. And of course, what is important to be emphasizing through it all is the fact that because of the pandemic, most people have not gotten their annual exams or their screenings. And so it's important to emphasize how important it is to get these screens, even though the pandemic is making it make you feel uncomfortable going to areas like the doctor's office. So these are just some of the things that were emphasized in this article talking about women's health, as the emphasis on women's health is now becoming something that women live longer than men, and so it's important to have them to have a quality of life as they age. It's true for men as well, but it becomes even more important for women because they live longer than men. Anyway, these are some of the issues that were stressed about women's health and how women should take charge of their own health and be sure that they take advantage of screenings and be aware of the health changes that occur as you age. Any questions or comments you want to make about that before we go into the?
One question I had was, other than family history, have the doctors figured out why there's so much cancer in the, in people, especially African American?
No, we don't know why. Yeah, but we just know that, as you pointed out, that African Americans have more African American women die of breast cancer than white women, and cancer is a disease that afflicts us. The prostate cancer, we have African Americans have more prostate cancer than whites, and so, but we do not know why. What was your question? No, do not know why. We just know that that is the case.
Good morning, everybody. Happy New Year. There was an interesting report on Good Morning America this morning about the connection with women with heart disease and dementia. And for Black women, I think just deductive reasoning, it has particular importance because we do have a higher incidence of cardiovascular disease, heart disease, hypertension, et cetera. But they are finding a connection now between heart disease and dementia in women, especially.
Any other comments you want to make about this very important topic?
I read it.
Go ahead.
Oh, good morning. I read an article, but I don't know about fibroids in women, and they say that caffeine and chocolate and all that produces more growth. But I was just wondering because as far as statistics, more Black women have fibroids, and then there was, I don't know if it was a myth or not, more children you had, the less chance you had of fibroids. Somebody wants to address any of those myths, or are they true?
Which myth do you want
About does caffeine and all of that promotes the hot flashes and everything, and about having children, more children, that you have a less chance of having a lot of fibroids.
I'm not aware of that information. Right. Certainly, fibroids are problematic in women from the age of 20 to 50. I'm sorry, after the age of, after menopause, but between the ages of 20 and 50, fibroids start becoming problematic. I'm not sure about the myths that you present relative to caffeine and having children, though.
Well, when you say myth, there's a presumption that is untrue. And what I've read is that the more pregnancies that a woman has, the less chance of fibroid development. And then the other thing is that the more pregnancies, it delays the onset of menopause because, whenever you're pregnant, you're not shedding eggs through the regular monthly menstrual cycles. And a woman does not runs out of eggs later in life. And when you run out of eggs, that's the onset of menopause. And so you delay your menopause by the more children you have.
Is that why our grandmother had her last one at 53? Because she had 15 children? Okay. So I need to add more children before I had menopause. Okay.
Having children will extend your childbearing years.
Mm.
One of the healthiest things a woman can do is have as many children as possible. It's healthy for women. It's unhealthy for a man's finances, but it's very healthy for a woman.
Yeah, Dr.
Any
Callender,
other comments?
I had a question about HPV. That's the human papilloma virus. And I think we talked about it last year, about the vaccine for that. Do you have any information about the vaccine?
Yeah, we talked about it. Yeah, the vaccine should be given from the age of 9 up to 45 because the virus causes cancer in men, oral cancer in men, and cervical cancer in women. And for that reason, the earlier you get the vaccine, the better. And it's important that the men take the vaccine because they're the ones who are spreading the virus by sexual transmission.
Is that a one-time event? Depending
No,
on
it's given in two doses. Yeah. Oh, we mean once you get it. Yeah. Okay. Yes. Yeah, it's a one time, but it's given in 2 doses. Yeah.
You know the time period between doses?
I don't remember, but it's a short period.
Mm-hmm. Okay. Thank you.
Any other comments about women's health before we go to the Buchanan and the?
Yeah, and I introduced some articles last year. There's not a lot of scientific study, but there's some suggestion that there's a relationship between hair straightening products, permanence, and creation of fibroids in women that may account for a higher incidence of fibroid among black women.
Any other comments or questions? If not,
I have a question. I was told that once you reach the age of 65, that you no longer needed to do a pap smear.
that's correct.
Okay.
And actually, if you have taken the HPV, the need for pap smears becomes unnecessary because the major cause of cervical cancer is the human papilloma virus, and it will prevent that. But most women have not had the HPV because we haven't been requiring it until recently. So.
Dr. Callender, you mentioned
With that means that those people who have the HPV, they won't need to be getting any pap smears. Yes, John.
You mentioned the NIH with women's studies. Is there an institute for study of women's health at the NIH?
Yes. Dr. Clader, who actually is one of our Howard graduates, is the director of the women's health at NIH. Denise Clader.
Howard graduate. Okay, got you.
Yeah. She's actually an ophthalmologist. Yeah. Okay, John, I guess you can start the launch. Yeah. And John is gonna have to leave us, so I'll have to be praying for him as he has his surgery today. Well, this is an interesting article because it points out that the anti-vax people have been around for quite a while. And there's nothing new about the anti-vax. And this is Benjamin Franklin, who had a son who died from smallpox. And he regretted that he didn't let his child be vaccinated because it might have saved his life. And that's why. But the popular skepticism has always been there, and the people protested the vaccines forever. So the anti-vax people are not new in this. This is something that throughout time has been the situation. The side effects of vaccines have been of concern, and some people forget about the positive aspects of the vaccine and dwell on the negative, and there are side effects from the vaccine, as we all know. Yeah.
Just,
And I
just
guess my,
mention
my
the
guidance is,
HPV.
but I'm sorry?
Just mention the HPV vaccine as well.
Right. And this points out that, yeah, there are side effects. So, it's the reason we do it is because the risk benefit ratio is so high for the benefits versus the risk. But there are risks. And as we get better and better vaccines, then we'll have fewer side effects. But right now, we still have significant side effects. That's an interesting data that COVID was the common killer of children between 5 and 11. And then, of course, Delta made it even worse. But it's interesting how the reason vaccines are only mandated in hospitals and other such places is because you don't want the hospital to be the source of your infection. And so as part of, that's why it can be mandated in hospitals and not other places. Because you can have freedom of choice, but when you go to a hospital, you don't want to have the staff giving you a disease that could be prevented. The one thing about the coronavirus is that for the most part, it's free. So everybody can have it if they want it. Just that some people don't want it.
Dr. Callender, I think I remember getting the polio vaccine on a sugar cube. Is that how they gave it to the kids in school?
I don't know how they gave it in school. That's a little ahead of my time. So. Those viruses that kill you like smallpox, polio, and meningitis are the ones which vaccines are most beneficial for. It's interesting how the reasons for not taking the vaccine have varied from year to year. One of the questions that is asked these days is when does the pandemic end, and what is the evidence that the pandemic has ended? Any ideas or thoughts about that question, which is often asked?
My answer is that I have the kind of residue philosophy. You know, the pandemic will go down, 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 and down, but it won't go away completely.
Well, so in many ways, it becomes endemic and not pandemic when we have antibodies. You know, just like, for example, the flu. The flu is with us every year, but because you take the vaccine, you don't get hospitalized and you don't die. And that's what we're seeing for the most part with the Omicron. People are not being hospitalized or dying as a consequence. And some people forget that that's the purpose of the vaccine in the first place, to not to prevent you from getting the infection so much as preventing you from needing to be hospitalized or dying from the infection. So in many ways, we're approaching the end of the pandemic as we see it, as we look at the data, and we see more slides that show that the Omicron infection is not causing as many deaths nor as many hospitalizations, and that's what the vaccine is given for. And that's what this article is all about, telling us that as John had said, that we go from a pandemic to an endemic, and a situation where you get the infection, but your body's able to fight it off, and you therefore don't require hospitalization or die. Now, as you recall, there's still many people who don't take the flu vaccine, and you have people who die from the flu. And most of those people who die are people who have not taken the vaccine. So, because the flu is endemic, and as of course the latest version, of course, is the Fluorona virus, which is the flu plus the coronavirus, and if you have vaccinations for neither, then of course the likelihood of infection and hospitalization and or death becomes more likely. And I think this is something we have to become more aware of as we face the future. Any comments or questions about that perspective?
Doctor, this is Kevin, and I heard on the news the other day, in regards to the Omicron, that one of the biggest, signs was having a sore throat, and which I had, but I tested negative with the antigen, and now they're saying that it's possibly because the sore throat is one of the biggest things that comes out, that we should be swabbed in the throat instead of the nose. Have you heard anything like that?
No, I've not heard no evidence that you should swab the throat instead of the nose, because the virus is in both the nose and the throat. But another symptom that is becoming prominent with the Omicron is headache, sore throat, as you mentioned, and headache and sniffles and other things that are a milder version of the viral infection.
Dr. Callender, I thought they indicated also that high fever was the biggest symptom.
Not really for those people who are vaccinated. For people who are not vaccinated, it may well be. But for people who are vaccinated, many of them do not have fever, and they don't have any loss of taste or smell. So for the unvaccinated, fever and chills are common. But for the vaccinated, it is less common.
Yeah, I had fever for one day, and that was it.
Yeah. So it seems as though we're getting closer to the point that we're dealing with the endemic nature of the virus. Now, this has caused a lot of discussion, cutting the isolation time for people with asymptomatic coronavirus infection. Because if you're positive for the virus, whether you're symptomatic or not, you still need to be quarantined. And the quarantine for 10 days was thought to be a bit much. And so they cut it to 5 days. And more recently, Fauci has suggested that if you have doubts about it, just be retested in 5 days. And if you're negative, then you don't need to quarantine any longer. But this is something that has been the cause of a lot of discussion. Any comments about that?
Yeah, I was a little confused because when I had COVID at the end of my quarantine, I went in for testing, and they told me that testing was unnecessary, that I would continue to test positive for COVID for 90 days, and that they just assured me that at the end of the quarantine period that I was no longer contagious and just to go on my way.
That's generally what is said. But except that now, Tony Fauci is suggesting that you should be negative after 5 days.
Yeah, I tested negative on Monday, and I took a PCR test yesterday, which is going to take 3 or 5 days to come back, but all my symptoms are gone. I did not have any headache or fever at all. I just had cough and nasal congestion. I started with a sore throat like you, Kevin, and I think it ended with a very slight sore throat. It wasn't bad at all. Very, very mild symptoms. And I'm pretty sure that's because of the my vaccination and booster situation.
Okay, so it's a lot of people have suggested that the real reason they did it was because of economic issues and not health issues. But time will tell. But the 5 day is the thing they're going by now. Yeah, this is the article that Fauci talks about adding testing to the new 5 day isolation period. This is new. So what they told you, Darryl, is something that people have said from the beginning of the viral situation. But I guess we're having more data now to validate the 5 day situation.
Are people able to get tests at the drugstore?
I don't-
Most of the drugstores were sold out that I went to.
You
10
can't buy
different
tests.
drugstores.
Yeah, I think that's the case. Most of the tests are gone, and they sold them, and the free ones that Biden is supposed to be providing, a number of people haven't gotten them yet. And so you still have lines for people who want to be tested.
Dr. Callender, I waited in line yesterday at the Petworth Library. They started giving them out at 11. I got there a quarter of, and the line moved pretty well, but it was 2 blocks long.
Wow.
Yeah, 2 blocks long. And you can only get two rapid tests.
Mm.
And it ended right when you walked up, right?
No, I got my 2. And at the other libraries in DC, they're giving they call it test yourself, where you actually send the test tube in and they collect them at the library. You do the swab and take it back to the library. And that's one I did yesterday, where it's the RT-PCR test, and all that's free. But there was no line for that. Yes, on Monday.
Yeah.
On not Monday, Wednesday. Yeah, yesterday.
The longest lines are in Chicago. Some of them go all the way to Cleveland.
Oh,
Wow. Well, it's not so bad in the warm weather. The cold weather, it's a problem. So most people in their cars, or they just standing out in the cold?
We stood out in the cold, and the trees were dropping their snow on us, and yeah, it was. But the line started moving.
But the interesting thing is that somebody called me yesterday about getting a test, because while Howard was doing the vaccinations, they were not doing testing. So there is a need to find a way to get tests so that people don't have difficulty getting tested when they think they have the virus.
We were able to get 2 free tests. Like John said, they were giving out 2. So we were able to get 2 of the free tests. And I was also able to order 2 off of Amazon. So those haven't arrived yet, but I tested positive on the 31st of December for COVID.
Wow.
And I think I just had like a low grade headache. But the reason I went is because my grandson had to be tested before going back to school.
Mhm.
So I said, well, I'm gonna get tested while he's going. Meanwhile, my two younger ones was tested like maybe 5 days before, and they hadn't received their results back yet because they had the one that takes 3 to 5 days, and theirs came back positive as well. But they have cough. They don't have like a lot of symptoms because they're too young to get the vaccine now. So I was just so pleased that they did so well with it since they weren't vaccinated at all.
Yeah, it's interesting that for the most part, coronavirus has not been as lethal for children as it is for adults. And of course, there are exceptions, as we mentioned. It's still a significant cause of death in children. Now, it's interesting that the CDC drops its estimate of the Omicron cases because you see a variety of results. You see one place says 50%, other place is 70%, the other place is 90%. So who do you believe?
Dr. Callender, I included this article because it was early when I first saw it. This was the case. This is the 28th of December. The next article shows the real deal now, though.
Yeah, it was 90. Yeah. So, and the issue, as we'll see, is not it's communicability, and but its transmission is more so than Delta. Fortunately, the mortality and hospitalization rate is 50% or a third to that of Delta. So
And
it's
that's
more
what makes it scary.
it's
Yeah.
more communicable, but it's
Yeah.
less likely to cause hospitalization. And
Right. With Delta, I didn't seem to know anyone personally. And with Omicron, everybody you know have it or have had it. As you said, luckily, they're not being hospitalized like it was in the beginning with Delta. But obviously, it appears it's easily spread. But someone told me there's another variant out there from France that's just as bad as the Omicron variant. Is that true, or are you aware of something?
well, there's another variant, but it's as I mentioned earlier, there's a variant called Fluorona virus, which is a combination of the flu and the coronavirus, where the people get joint infections. That's the one I've read about that they mentioned in the newspaper today. That's the newest variant that they talked about. And I think it's going to be, as I mentioned earlier, that it's going to be problematic for those who don't have the flu vaccine, neither the flu vaccine nor the coronavirus vaccine. And I think that we have to keep in mind, as with the flu vaccine, there are going to be variants every year. So it's something that's going to be with us. And the question is, will we have to take booster shots annually or not? And that we don't know yet, but we will know soon.
Dr. Callender, can you explain variants and how they come about? Okay, we had COVID, then was Delta, now there's Omicron, then as
there's going to be others. That's the nature of viruses, is they mutate and they change. And that's what we call mutate. It means that the way that the surface changes, and that occurs over time with all viruses. And that mutation makes the transmission and the lethality of the virus vary from time to time. And so when we talk about mutation, we talk about virus changing, and that change may make it easier or more difficult for you to fight it off or avoid hospitalization or death. So, and that's why with the flu virus, because of the changes, we have different flu shots every year because of the changes in the virus.
Okay.
Yeah,
Okay.
the variants follow the Greek alphabet. And so if you notice, like from alpha, beta, gamma, delta to delta, there's several variants in between, and the same thing for Omicron. But they only give publicity to the significant variants that cause a lot of hospitalization and deaths. And so, if you follow the Greek alphabets, there have been at least 20 variants so far.
And there'll be many more. So it to me, what it means is that you should be vaccinated. That's your best shot, although the unvaccinated have a harder time than those who are vaccinated.
And of course, being vaccinated doesn't really mean anything if you haven't been boosted.
I wouldn't say it doesn't mean anything.
Okay.
But it's more important if you have a booster because you're better able to fight it off. Because what happens is that the antibody titer goes down after 5 months. And so you have some protection, but not enough to, not as though you had a booster, which would give you enough protection to fight it off. So I wouldn't say not having any vaccination is good. I think you need to be vaccinated, but you also need to get the booster. It's clear that the booster is important.
And some don't believe that. Oh, I had the 2, so I've been vaccinated. But to be completely vaccinated, you need the booster, correct?
That's correct.
Yeah.
And this is a study that talks about how we had, and it points out, when you start talking to people who are positive, it blows your mind because the rate of positivity is impressive. I mean, when you go to a group and you talk about who's positive, you find so many people positive. So it's contagious, all right, and it's affecting so many people, so many more people than the original and even the Delta, so, which was more transmissible than the original one. And this is something that's the thing that I worry about is the areas that don't have any vaccine at all. I worry about areas like Haiti and some of the people in the continent of Africa, Black African continent, and that, of course, to me is a source of great concern. Not only because it's not good for them, but also because that's where a lot of the variants come from. But it is clear now that it is more contagious, but less severe. We talked last time also about the cloth masks and how they are less effective with this variant, which is so contagious. And so that if you don't have a layered mask, it is thought that you will be more likely to contract the Omicron virus, and that the cloth masks are ineffective at keeping it out. This is an interesting data that you see from South Africa, that 29% Delta, 2.7% hospitalization with Omicron. Now, this is why, as it says here, that people predict that by February, it will be long gone. But time will tell. We talked about this last time. It's not, it doesn't hurt to re-talk about it, what to do if you turn positive. And isolation is the first thing. And the second thing is masking and social distancing. Yeah. And this was the most recent, and that sign you see is what you see at most of the drugstores. No more COVID rapid test.
Mhm.
So the question is, and I haven't seen much data on this, is how has this impacted the flu cases? And I haven't seen much information on the quantity or quality of flu cases, whether the mortality rate remains the same or not. So, although the Fluorona virus, which some people are talking about, the twin virus of the flu and corona, is still an issue, but especially for those who have neither of the vaccines. This is an article that educates you about the rapid tests and the fact that you have false positives and false negatives. But the value is that even if you have a false positive, you can find out later if it's accurate or not. And it doesn't hurt to act as though you're positive. Any comment or thoughts about this rapid test and any reason not to take it, even though it does have a small percentage of higher percentage positivity than the previous test?
I mentioned this at a performance I did. That was back in, I think it was even September, where they demanded you show your vaccination card to get in to the
Yeah.
performance. And if you didn't have one, they offered the rapid test and the PCR test right across the street. Just walk right across the street, and they had 200 people took took their rapid test and the PCR test that night. And the ones who had the negative rapid test could get into the performance. I think
That's
that may be a vision of the future.
Yeah.
Were they charging for that test?
No, free
Okay.
of charge. Yeah.
Well, it's we're in a new era now. It's amazing how things change so much. Over the last 2 years, it's like a different planet. And the impact on economics is just horrifying. You see so many businesses closing, and it's tough. And then, of course, the impact upon the health profession is something that has not been appreciated yet. You have a double whammy of the fact that if you work for a hospital and you're not willing to be vaccinated, you lose your job. So that decreases the staff. And then when you have increased patients, the staff have to work twice as hard, and that causes mental issues and other issues and other health issues. So it's it's a vicious cycle. And what is most problematic is that the people who are working to take care of the sick, their mental health issues are not being addressed significantly. And that's something that we anticipated, but really haven't done much about. And so we have health workers who become mentally ill and even commit suicide. So it's an issue. And then there's a question about whether the test can detect the Omicron, and most of the tests appear to be able to. If you have coronavirus, they're able to detect it in spite of the mutation. Many would argue that one of the ways in which we haven't been as helpful is that we haven't come up with the rapid testing paraphernalia earlier. We should have come up with it earlier. We're very late in doing it. So that's one of the things that we've learned. And the answer is yes, they do detect the Omicron variant, but they may be less sensitive, but they do detect the variant. Now they do have a test, by the way, that at the hospital where they can pick up whatever virus you have by the same way you do that nose examination. And you take that swab and send it to the laboratory, and they can find out whether you have what kind of viruses you have. And they have about 5 different viruses which they look for, including the flu and the different coronavirus variants.
Dr. Callender, when I had my my PCR test back, forget when it was exactly, when I was sequestered out of my home at Kaiser, that was the kind of test I had. They had a whole range of different viruses, SARS. They had different SARS viruses as well.
Right.
That was sensitive to.
Right. So they have that test is now available. So at hospitals anyway. Well, it's interesting that there has been a surge of cases, but the cases are not as severe. You see a lot of people in the hospital with coronavirus, but they're not often on respirators and not often in ICUs. So yeah, they have more cases, but not dying and severely ill as they were formerly.
Dr. Callender, remind me of what the PCR test is.
A PCR test is a test that goes specifically for the antigen that causes the viral infection. And it's a, let me see, how can I simplify it?
I can help, Doctor.
I'm sorry?
I can help, Dr. Callender.
Okay.
Yeah, the PCR, that's the polymerase chain reaction. And what it does, it could take a small piece of genetic material, DNA or RNA, and amplify it in a machine that makes that very tiny sample big enough to be measured. It's a pretty simple process, but it took a long time to get it. Once we got it, its use has exploded across the biotechnology world. PCR, polymerase chain reaction.
Well, it's right. It's not new. It's just that it's become vital for this particular issue. But PCR has been around for quite a while. It's amazing how genetic testing now is becoming common discussion, whereas genetic testing was just mentioned, but not discussed to the extent to which it is today. This is another article that talks about the risk of this Omicron variant. And I guess, and I think what this points out is that the vaccine has been very effective in avoiding hospitalizations and deaths. And sometimes we don't recognize that what this means is that the vaccine is very effective. So in many ways, it's a sign of an effective vaccine. Now, it's interesting because when you're in the hospital and you see patients, many of the patients who now are in the hospital with the viral infection can be on the wards and not in the ICU, which is very different from how it started off. Now, this is interesting to test to see if you can stay in class, which is an interesting way of putting it.
Yeah, they have that in DC now, Doc.
Yeah.
Callender.
And I think it emphasizes that the homeschooling for many was not as desirable as we thought it would be. It varies. Some people do it well, some don't. And it seemed not to be good for majority of people. It's interesting because when you have homeschooling, it's difficult to tell whether the student is actually paying attention or not. And that's where the problem lies. I think if you had ways of ensuring that the students were actually paying attention, were actually watching what you're doing, it might be as effective, but that's not the case. So.
It's also really hard to do a chemistry or physics or biology laboratory at home.
Yeah, that's right. That's the other problem. Yeah. Yeah. You know, it's interesting because our school system was not producing students that were competitive with other countries. And so that will be even worse as a consequence of this and not being able to go to school. Not to mention the mental health issues that develop as a consequence. That's interesting that many schools are delaying, colleges are delaying the opening because of the Omicron tests, positive tests. Any idea what's the impact upon this will be on the colleges? Haven't seen much except it's just delayed, but I haven't seen much about which schools are going to delay and which aren't in DC anyway. I know it's been problematic for the younger kids to wear masks and to keep them with the mask on. So it's been a difficult situation. How do you get kids to wear a N95 mask? It's hard to get adults to wear them, not speaking of children. And now that we're saying the cloth masks are no longer effective, will they make cloth masks which are now layered so they can be effective?
Dr. Callender, at my church, they're going to buy a bunch of KN95 masks and hand them out at the door, free of charge.
Oh, so they are going to continue to have church then? Because Asbury stopped having church services.
Yeah, well, they're considering it because our enrollment is so low. We're talking about only about 20 people show up at the church.
Oh, I see. Oh, yeah.
Our enrollment is very low.
I see. So, yeah. Well, I think at Asbury they probably had about 50, but anyway, they chose to stop in-person services, and I believe it related to the fact that there were people in our who were part of our church who came down with positive tests, and so they decided they would stop having in-person services. What is the biggest drive to have in-person schooling? Is it because the parents want to go to work, or is it because the children are not learning well? What do you think?
I think it's free lunch.
I think children are not learning. Then again, I have no young ones at that state, but I think this past year, if you were to analyze all of these kids, school-age children that were doing virtual learning, did they gain everything that they would have while in school? I would think not even half of the education that they would get in school are they now getting at home. And a lot of times the parents have other responsibilities they're not able to oversee. A number of reasons, but definitely it's not comparable to them being in the school setting. But you have to weigh the odds. Go to school, you might get COVID, home. Will I take the time to teach my child or work with my child? Some are saying no.
Yeah. Good point. Very well. This is interesting. Teacher arrested for injecting a minor without parents' approval. Oh boy. It's interesting. Boy. It's amazing all the things to get arrested for. That's one. Another one, I tell you. Well, of course, this doesn't tell you the whole story, and I guess there's a lot more to it than is in this article.
It was at the teacher's home.
Yeah, right. Yeah. Interesting that he was at the teacher's home. So.
And where did she get the vaccine? Where did she get the vaccine from?
We don't know any of that. That's right. Yeah. Those are the unanswered questions. Yeah. Now, this is something that Fauci and CDC, a 5-month gap rather than 6 months. Now, the population that still is unclear is the immunocompromised patients. We still don't know what percentage of those patients have an immune response that's immunoprotective and how many boosters are necessary to get them at the level that's necessary for the vaccine to be protected. And so that's a patient population that still needs a lot more study. How many boosters is enough?
Dr.
And
Callender, I have a question. Is there, you're talking about immunosuppressed individuals, and you can measure their, I guess you can measure somehow what their immunity is like by the medicines they take and the results of the medicine. But you can do the same thing for immune compressed people. You can test how, what their immunity level is.
yeah, you can. And the question, the problem is that they haven't been able to. I think the Hopkins group has done most of the studies on the immunosuppressed patients, and that hasn't been updated recently to tell us any more about how, as a consequence of after the third shot, how many people needed a fourth shot, and so forth and so on. And that remains still unanswered. It's clear that many immunosuppressed patients will need a third shot, but how many will actually need a fourth shot? And that's the question that's still not clear.
That's true. On TV the other day, they showed this transplant patient, and she had all of her cards, and she had been injected or vaccinated 5 times. And I think you're trying to build up the antigen or whatever it was. She still didn't meet that mark and felt like she still wasn't safe, even though she had 5 injections.
Yeah, that's why the time to get the vaccine is before you get immunosuppressed. And that's why a lot of transplant centers are requiring you to be vaccinated, or else they won't transplant you. And why are so many vaccinated people getting COVID-19?
Yeah.
And the answer, of course, is because the virus is more transmittable. This variant is more transmissible, more contagious. And remembering what we said at the beginning of the program, that the effectiveness of the vaccine is not necessarily to prevent you from getting infected, but is to keep you, when you get infected, from requiring hospitalization or death. So even if you get infected, it still does not mean that the vaccine is not effective. And I think some people haven't recognized that the vaccine is effective if, when you get infected, you don't require hospitalization or death.
Dr. Callender, why do you check my tacrolimus level?
Why do I check that? Because
Yes.
it tells you whether your level of the drug is adequate to cause immunosuppression. And we have identified that at a level of above 5 milligrams, that is a dose that is desirable. From 5 to 10 is desirable. And if your dose level is less than that, sometimes we want to increase it to get it to that level. Unless you've been transplanted for more than 10 years, in which case, if your level is at 4, nobody's going to quibble, because if your transplant is still doing well and your numbers are well, then it means that the level is adequate. But early on, we try to keep the dose at a level that will keep you effectively immunosuppressed. So that's why we do the tacrolimus level often in the first 6 months and then infrequently after that. Now, this is an article that you may quibble about because it talks about many options. And they talk about whether you've had 2 doses or 3 doses or 4 doses. And 1 dose was 2 or 3. And so it becomes complex. I would think that if you've had no vaccines at all, that to me, that would be a red flag. But he talks about all of the negative aspects of wearing a mask and not wearing a mask. And I don't agree with his premise, but anyway, this is what he says, and it's a bad idea. I don't know about that. But anyway, it's an interesting article because it talks about the pros and cons of domestic travel and vaccine passports, and then the answer is not out yet. And I think that the virus is going to be endemic, and people will be infected and reinfected many times in their life, and that is true. And one of the issues that is buried in this is that if you get COVID and that will in effect immunize you. The question is, how effective is that immunization from that route compared with the immunization from the vaccine route? And of course, that is the million-dollar question, because the patient who's had COVID is immunized. The only question is to what level or what extent is that immunization.
And how long that immunization lasts also.
Also, that's correct. Yeah. And those are aspects that we really don't know all of the answers to. And with time, we will get them. Right now, we don't know all the answers. And it's nice that we have a product that we feel safe with for the 12 to 15-year-olds, because that's a large group of people. It's interesting, they talk about the immunocompromised 5 years old, 11 years old, requiring an additional dose after 28 days after the second shot. And of course, the group under 5 is left alone. And I guess we've talked about this already, about the different kind of COVID surge and the fact that you got serious staff shortages and healthcare workers getting sick. And what we haven't talked about, unfortunately, is what is being done to help these staff people. What is being done about their wellness, their mental health, and their other wellness aspects. That's the missing ingredient right now. And I think this group asked great questions last time in terms how you asked, how do we prepare for taking care of the mental health issues that we knew were coming as a consequence of COVID? And the answer is little. We did little, if anything. And this is bad news, because we're going to pay a price for that inactivity. And that price may be more health workers dying from suicide or other things. So this is something that becomes very critical. You analyze it well and recognize that the mental health issue is an issue that we have poorly prepared for. And I haven't seen anything recently that suggests that we are doing anything to address that deficiency.
Also, Dr. Callender, question that individuals who are trying to get elective surgeries and things, sometimes they have to delay those because the hospitals are all full with COVID patients, right?
Yes. Yes. Yeah. And that's true. It's just, and also, of course, before every surgery, you have to have a negative COVID test. And people call the ambulance because they haven't trouble finding a test. Yeah, well. Now here's something. We are drowning, we're exhausted. Yeah, that's right. And this is the issue that we have not addressed. Can you imagine 85% of the hospitalized COVID patients were unvaccinated? He promises to get vaccinated. Well.
What is the situation, Doc, for someone who was unvaccinated, who got COVID, who recovered, and I think I heard that they should get vaccinated even
That's
though.
correct, without question, yeah. And they don't get credit for being immunized because they had COVID. They still need to be vaccinated. Did I hear somebody speaking?
I just got interrupted, that's all.
Oh, okay, all right. Okay. The new bird flu, but it's always something, huh? Xenozoonosis. The coronavirus began with xenozoonosis from bats, we think. And so now we have a bird flu, which is not unusual. Always something. And we talked about this before about the anti-vaccine vaccinations, and that's always been with us. And we also talked about the xenotransplants and the animal rights people who will begin to protest that when that becomes popular. So, and that's what some would say the nice thing about democracy. You have the right to protest. And then those people who get angry because you're wearing a mask. COVID was all a fabrication. Oh my goodness. It's amazing how the truth is considered a lie by some people. Well, today is a day of remembering of Trump, who tried to take away our freedom of the vote and supplant it by his own methodology, and was caught in the act, but was not penalized for it. But anyway, because that's one of the most despicable acts a president could take. But he took it and he didn't have to pay for it. Well, it doesn't matter who he credits for finally getting the COVID vaccine. I mean, he got the vaccine, so who cares? And this is a guy who missed the Olympics because of that. And now he's still, well. That's interesting, though, that people would try to make it a bad thing to get vaccinated because of the mandate. It's a mandate because it's healthy. That's why it's done. Any other issues or questions? How was your New Year? Any of you
That
have-
was
Peaceful and quiet.
very
Okay.
good.
Very peaceful and quiet.
Anybody have New Year's parties?
No.
Nope.
What?
Party of one.
Exactly.
Very quiet.
Safe.
We bought in New Year's with the family on Zoom.
Okay. All right. So no New Year's parties, huh?
No.
Hmm.
And I
Interesting.
didn't even get to go to church. And I'm kind of glad I did go because it